long-term conditions, what are we talking about? I guess this means things like diabetes, asthma, hypertension, osteoporosis, all that stuff. These conditions which we see every day and for which we prescribe often lifelong medication to tens of millions of people. And the quantitative information about the benefits and harms of treatments. So this is basically about numbers needed to treat and absolute risk reduction. And people could give some examples of where they use this sort of information in consultations, usually around statin prescribing and being able to talk to people about, this will reduce your risk of a heart attack or stroke over the next 10 years by this much. And then there was another aspect of the use of quantitative information, which is a little bit softer perhaps. So things like people using QRISK to figure out people's baseline risk and using that to frame conversations or make treatment threshold decisions, but not really being aware of what happened to that baseline risk with treatment. I don't think there's going to be a prescriptive solution to all this. Anything that's going to come into real world practice has got to exist in that environment where we're all doing the best we can, we're satisficing and bringing together as many bits of information that we have as we are able to and as we wish to with a patient. If I had some easily accessible information about the chance of treatment benefits and harms, that would be really useful, and I think I'd like to use it in my practice in certain places.